Hi, my name is Leia Beland, and I'm a Ph.D. student at the University of Windsor in the School of Social Work. And I'm going to present my rapid review of significant findings from safer opioid supply programs. So the agenda is an introduction, the methods, my inclusion criteria, the studies that we used, the results, and a discussion. So just some background, between January 2016 and June 2022, there were 32,632 apparent opioid-related deaths in Canada and 33,493 hospitalizations for opioid-related overdoses. And these are numbers from Public Health Canada. Safer supply has been advanced by a group of communities of people who use drugs to offset the risk of overdose from Canada's toxic drug supply. Providing prescribed medications is a safer alternative to the toxic illegal drug supply for people who are at high risk of overdose and has been taken up informally by physicians and nurse practitioners. Though, as we'll see, these processes have been taken up more formally by primary care physicians and nurse practitioners, social workers, and social service workers to form wraparound care services for people who are at risk of overdose. This review looks at agencies that are working within risk mitigation guidance from British Columbia's Centre on Substance Use, or providing safer supply programs, and are publishing quantitative data. The data from these harm reduction programs shows promising results in decreasing the rates of death from opioid overdoses and providing care to individuals with opioid use disorder. So, drawing from Cooper and Trico's 7-stage process, a rapid review was performed. The core databases included Medline, Ovid, Embase, PubMed, PsycInfo, Omni, International Clinical Psychopharmacology, and the Journal of Substance Abuse Treatment. These were searched for quantitative peer-reviewed studies that were completed between January 2015 and December 2022. Although the majority of studies have come out in the last 18 months, the collection of data on safer supply and prescribed medications began about 7 years ago or a little bit earlier, depending on where you look. The keywords were SROM, SROM, or slow release oral morphine, or immediate release hydromorphone, HDM, opioid use disorder, opioid and supply program, opioid and supply or supplies and program, opioid and safer supply, and RMG, or risk mitigation guidance. Using these keywords, core databases that were in the previous slide were searched for quantitative peer-reviewed studies using any intervention with prescribed immediate release hydromorphone, slow release oral morphine, Dilaudid, or Elson. This did not include injectable opioid antagonist treatment or opioid antagonist treatment. So after title and abstract screening, 22 records screened, the majority of the articles looked at the impact effectiveness of opioid antagonist treatment, or there were gray literature or qualitative reviews. So only 4 studies met the inclusion criteria. And these 4 studies were, the initial one was from the London Intercommunity Health Centre in London, Ontario. And this was the clinical outcomes and healthcare costs among people entering a safer supply program in Ontario. So Gomez and performed an interrupted time series analysis of residents who entered the safer opioid supply program between January 2016 and March 2019. And a comparison group of individuals were matched on demographics and clinical characteristics, and they were not exposed to the program. All of these 4 studies that I'm going to present to you were observational. And two of them were brief retrospective cohorts, essentially surveys, and the other one was a pre-experimental case and a quasi-experimental, and this is a time-interrupted series that we see here. In the time series analysis, the rates of emergency department visits, hospital admissions, healthcare costs, not related to primary care or outpatient medications, all decreased. And these promising results were also seen in the three other programs that met the inclusion criteria. So the Kool-Aid Community Health Center, the CACHC, Risk Mitigation Guidance Prescription Program Victoria, explored the early implementation and impacts of British Columbia's risk mitigation guidance through a chart review and interviews with staff and community researchers. The CACHC explored the impacts of implementing risk mitigation guidance in the context of an illicit overdose emergency. Data were extracted from electronic medical records, as well as prescriptions dispensations data from the provincial pharmacy database. And based on the provincial risk mitigation guidance and standards of care that were developed by the team, risk mitigation guidance prescribing was available to all clients with active and ongoing opioid use disorder who are at risk of death and danger associated with toxic drug supply. The third study was out of Hamilton. It was an impact of an integrated safer use space and safer supply program non-fatal overdose among emergency shelter residents during a COVID-19 outbreak. So this was a 26-day safer supply program at an emergency men's shelter in Hamilton, Ontario, that worked alongside the hospital-based addiction medicine and a local harm reduction group to establish a shelter-based opioid antagonist treatment and safer supply program. This was a volunteer-run safer drug use base that also distributed harm reduction supplies. So this was a wraparound care model, a partnership that happened between the Hamilton Social Medicine Response Team, the HAMSMART, and Keeping Six Hamilton Harm Reduction Action League, and the Inpatient Addiction Medicine Service. It was a four-component model that brought together a shelter with prescribed opioid access, harm reduction supplies, shelter overdose response capacity with trained residents and staff. And our last model was also a COVID-19 isolation hotel shelter. This was an organization that pivoted during a COVID-19 outbreak in the spring of 2021. This was an outbreak in the congregate system in Halifax, Nova Scotia. Over 25 days, 77 residents were admitted to COVID-19 isolation hotel shelters and referred to the medical team. They were provided there with immediate release hydromorphone tablets, stimulant tablets, benzodiazepines, and alcohol in a COVID-19 isolation hotel shelter. Now you can see through our descriptive statistics here and our results that there were significant reductions in emergency department visits, hospital admissions, incidents of infection. There were reductions in overdoses, and there were no overdoses in some cases. With the receipt of mental health medication and the continuous receipt of opioid antagonist therapies and prescribed medications over the periods of time. These outcomes show that the rates of among participants was really significant. This rapid review and knowledge synthesis provides some suggestions that safer opioid supply programs, interventions, including prescription opioids, harm reduction frameworks, advocacy, and collaborative wraparound care with physicians and healthcare workers have significant effects on total deaths from opioid overdose and associated harms. This review, while not producing any new information, does sort of encapsulate these four significant studies in which tentatively propose significant benefits, both cost and human cost wise, in safer opioid supply intervention sites. There further research evaluating the outcomes of safer opioid supply programs is urgently needed. This is my presentation. I appreciate your time. Thank you so much. And a special thanks to Dr. Kevin Gorey.